Hello, I'm Renee Langbart. I am the director of the Chamber of Commerce here in Clay Center, and I'm excited to have a special guest with me today. I have Austin Gillard, the CEO of the Clay County Medical Center, and thanks for coming, Austin. I'm glad to have you.
Thank you for having me.
Yeah. Okay, so let's just get started. You're kind of new to the community still. How long have you guys been here now?
We've been here about a year now, so May 1st or 2nd of last year I took the position as CEO of Clay County Medical Center.
I cannot believe it has been a year. My goodness.
Been a year.
So much. Time goes so fast.
Exactly.
So tell me, first of all, for people that don't know you yet, that haven't seen you, that haven't had to go to the hospital or whatnot, maybe you could tell us a little bit about your family.
Okay.
You have a new addition.
We do have a new addition, so I'm married, of course, and we have a 5-month-old son named Gavin. Michelle's a senior marketing analyst for a company out of Kansas City, so she works at home. And Michelle and I have been married a little bit over 3 years. Like I mentioned, our son's name is Gavin. He was born at Clay County Medical Center, and Dr. Kerner, who's a local physician here, did deliver Gavin right at Clay County Medical Center. And we also have a black lab named Bailey.
Very cool. Dr.
Yes.
Kerner is a great doctor.
She is a good doctor.
Yes, she's my doctor.
So, there you go.
Yep. Well, we are so excited to have you guys in the community. I love your young vibrancy about your family, and I've enjoyed getting to know Michelle very well, and we're very, very lucky to have you guys in this community.
Well, thank you.
I know that it seems like you kind of started to pave the way for more young families to start moving into Clay County, and that's what we need so badly, to have the younger generation step up and take those positions of leadership, and so that we can start building for tomorrow again. So
exactly.
So with that being said, I know that in your almost year of being at the hospital, that you didn't waste much time in making some good changes to the hospital, and things that you're still continuing to put into place. So maybe you could kind of fill us in on some of the biggest changes and some of the immediate changes that happened, and I guess some of the changes that are important to the public eye.
Okay, good. I don't know if I'd call them all changes. How about opportunities? There were a lot of opportunities at Clay County Medical Center to expand or to improve our services to the community and to the employees ourselves. So one of the biggest accomplishments and opportunities that I saw was we have a family practice group that's been independent for over 20 years in our community, even though I think most of the community didn't realize they were separate from us, but they were not employees of Clay County Medical Center. So effective July 1st, we will be blending those two organizations, Clay County Medical Center and Clay Center Family Physicians. There won't be any changes. The community will not see any changes. The only difference is the employees over at CCFP will just receive a paycheck from Clay County Medical Center. So a great opportunity, and with that, a lot of the new docs coming out of residency don't want to own their own business. So basically, when we were trying to recruit docs to our community, they didn't want to deal with accounts receivable, billing, coding.
Sure,
they just wanted to come in, see their patients, and go home and see their families. So with this recent blending of CCFP, we were able to recruit in another family practice doctor that also does OB, Dr. Laura Meyer, who will be joining us in August of this year. Yeah,
I agree with you. The perfect word is opportunities, because I know Concordia lost their OB.
That's correct.
And so, the trend is always that people move east, and, bringing more people to our community from an economic standpoint.
Right.
Hospital and doctor, that's one way to do it. So
exactly.
I appreciate the having an OB doctor here in this community. So I know that there'll be a lot of ladies that will be very thankful for that.
Yeah, she already has a waiting list.
That's fantastic.
So call ahead.
Yeah. So you mentioned about that the hospital was going to take over the family physicians. Why is that important? Like, why is it? Is there something other than just having those doctors, like with it being with the hospital? Is it helpful to the public in any way other than just having another doctor?
I wouldn't say, well, there's a large benefit. I guess, yes, there is a large benefit. Again, like I said, most doctors coming out of school now don't want to deal with the business aspect of healthcare, and that's what a lot of healthcare is now. A lot of rules, regulations, dealing with insurance companies, and basically all that responsibility is going to fall on our administrative staff. So the doctors can see patients, they can focus on what they're trained on, which is medicine and helping heal people, and let us do the business aspect. So that's a large benefit I see it for our community, and to keep more doctors coming into our community, because some of our older physicians are going to retire in the next 5 to 10 years. So we need to have a game plan in place for those physicians. And if we can recruit in the younger ones, then they can again focus on medicine and then go home at 5 o'clock or 6 and see their families and spend time with their kids. That's what we want to do. Exactly. We want to create that environment for the physicians.
Yeah, that makes sense. I think that's, everybody's goal inevitably in life is to not be completely and totally married to your job, to enjoy what you do, to do what you do, what you went to school for, and then not be overburdened with all the other red tape that I guess goes with a lot of different positions. So
exactly.
I think that sounds like a fantastic plan. Like I said, I'm excited for the community, and it makes sense to me to have that happen. So I know that with healthcare there, before you came, Ron would always talk about the different rules that kept coming every single day that were changed from even the previous day. And, so you can't focus on the patients.
Nope.
If you're constantly working
on a lot of
on
rules
that,
and regulations, so let the business people deal with the business, and let the nurses and physician assistants, nurse practitioners, and doctors focus on the patients.
Makes sense.
So that's what we're trying to do in the community.
Very good.
Other than that, we're looking at a little renovation project at the medical center. So our hospital was built in the 1960s. Still in great shape, great physical condition, but some of the parts could be updated. So we're looking at how do we maintain profitable as a small hospital? Because healthcare is moving from an inpatient model to an outpatient model. So 70% of the business now at Clay County Medical Center is outpatient. Only 30% is inpatient. So when you have a family member in the inpatient wing, so acute care or swing bed. So how do we keep growing that outpatient number to stay profitable as a facility? So we don't have to go to the community and say, hey, we need a mill levy increase. Hey, we need a tax increase to help float operations in our small town and for our hospital. So the renovation, we're looking at updating radiology, lab, and the surgery department. And why that's so important is surgery brings a lot of revenue into the facility, and you can also grow it. So if we can do podiatry procedures in our facility, if we can do orthopedic procedures, which is the majority of the procedures that could be done in our facility. So that's why we're kind of looking at a renovation currently.
So you'll be able to expand on what is offered at the hospital. Is that correct?
That's correct. Yep, the goal is to keep increasing that volume. And the orthopedic surgeons in Manhattan have been very helpful during this process, saying, well, we will come here and we will help provide those services if you update those surgery departments. Because right now the surgery department hasn't been updated since 1967. Wow. Healthcare's changed, and we're just looking to at least get to a modern age for that surgery department.
We weren't even born.
I was definitely not born.
No, we were not even
20
born.
years later.
Well, to me, that makes sense. I mean, all of that, obviously I don't have a healthcare mind, but I definitely have a business mind. And anything you can do to expand what you offer definitely increases the traffic to the business, whatever it is. And I know that before you were here, I would hear a lot of people that had to go elsewhere for procedures because it wasn't offered here. So it's great that you want to offer those here to this community.
Right, and we've been looking at some data, because everything's tracked now. There's data on everything. We have a lot of out-migration for different procedures in the community. So if we can provide those services here, we'd like to, as long as the patients here feel comfortable with the quality of care that they're going to receive at our medical center.
Excellent.
Yeah.
So have there been any challenges that you've faced over the last year?
Of course.
Yes,
of course.
I know. Anything that has you've been able to spin into a positive and make things better?
I think the staff of the medical center have been fantastic to work with. We do have a good, solid staff. We had to set a few expectations and ground rules, of course. Things change, of course, when you have a new management come in. But overall, the challenges have been basically simple personnel challenges. Financial challenges, of course, but I'm happy to announce that this year, this calendar year, we're running in the black.
That's fantastic.
Which we haven't done in quite a few years.
That's
so
excellent.
we had to go and make a few changes. When a person left, we didn't replace them. So more responsibilities are on more people now, or fewer people, I should say.
Yes.
So that kind of gets staff a little overworked and overwhelmed, but I think everything's leveling out to a good level now.
Yeah.
So.
Sometimes it just takes a little bit of time for people to get into the groove, and change is so hard.
It is hard.
My word, when
It
somebody
is
tells
hard.
you that you're going to do something different after you've done it this way for
Yeah, and the good part is, and I hope a lot of the community members realize this, a lot of the change wasn't done on the patient care standpoint. It wasn't done in nursing or in other departments that deal with patients. Most of it's administrative staffing, billing, coding, finance, all of those kind of departments. So just tightening that up, watching overtime, and not replacing positions if you don't have to. We're still the #1 employer in Clay County.
That's awesome.
But just because you're the #1 employer doesn't mean you should employ everyone.
Understood.
So.
Very good. So as we look to the future, what are some of your goals that you have that you would like to see happen kind of in the next year to 2 years, and then even further along down the road?
Okay.
What are some things that you would like to see happen?
So in the next year or two, I know when we do a hospital renovation, we already receive about 6 mills from the county, and our goal isn't to increase the mill levy or taxes on anyone, but we still do have to go to a vote for general obligation bonds, which the county will support if it's approved. So I know that's an opportunity that I'm looking forward to addressing with the community through town hall meetings, just to say, hey, we can cover this, or our current mill levy will already pay for this, but we still need to issue these, and it has to be backed by the county. So hopefully that'll happen within the next year, and then the renovation will take place in year 2 and 3, and then start bringing in the other specialists, so orthopedics, more podiatry procedures, growing general surgery a little bit more in our facility. So that's mainly the goals 1 through 3 for Clay County Medical Center, and keeping a strong primary care base and keeping OB in the community. So right now we have Dr. Kerner, Dr. Murphy, Dr. Worthen, and Dr. Thompson, and soon Dr. Lorimeyer that provide OB services in our community. And we just need to keep that OB base, because there comes a certain point in time, just like Concordia, when you don't have enough OBs coming in and your nursing staff gets stagnant. And we don't want that to happen, but right now we're very vibrant in the OB department. So
That's
just
awesome.
maintaining that.
Yeah. Again, that's part of the young families coming to the community.
Yeah,
and that's part of the equation. So
exactly.
I think that having a healthy hospital definitely is very attractive to people that we're trying to bring to Clay County. So
I would say so.
Yes.
And Clay Center and Clay County in general, I think, is attractive. That's why we came here. I mean, Michelle grew up in St. Louis. I grew up in Kansas City. But we find the rural environments more attractive. It takes me 3 minutes to go home and see my son and wife have lunch. In
nice,
Kansas
isn't
City,
it?
it took 30 minutes. So there's a lot of benefits to living in Clay Center and in Clay County.
Yeah.
And it's nice here. I mean, new pool, the zoo seems to be doing well, the country club. There's a lot of different things and parks to do for children and families in our community.
I agree. I'm from Atlanta, and I can't handle it when I go home anymore. I can't do the traffic, and it's nice just to have that a little more relaxed atmosphere. And
Exactly.
I think that there's a lot more to do in this community than people that aren't involved with it realize. And
Right.
so we are so incredibly glad to have you and Michelle and Gavin as part of this community, and so thankful that you came here to Clay County, and best of luck to you, and I know you're going to do great things. I just have to say, not to put him on the spot, but Austin's wearing a bracelet that says serve, and to me that says a lot about his character and his integrity, and so those are the kind of people that we really need in leadership around here. So thanks for coming, and thanks for being on our program today.
Thank you so much, Renee.
Yeah, thanks for coming.
Yep.
Well, we'll see you next time. Thanks for watching.